Honourable, just Dr. Paul Hutchison.
Thank you, Mr. Speaker. Maybe it's a premonition. Mr. Speaker, it is a pleasure to speak on this New Zealand Public Health and Disability Amendment Bill. One of the most profoundly important things about it is that 13 out of 13 of the submitters did support its intent. And I think that when that goes from a spectrum of the Council of Trade Unions to the PSA, to the New Zealand Medical Association, to the Nurses Association, that certainly says something. I think also, Mr. Speaker, it is timely to thank the members of the Select Committee for very constructive collaboration during the listening to the submissions, and also to thank the officials for their very helpful advice. I do note, Mr. Speaker, that in the first reading of the New Zealand Public Health and Disability Amendment Bill 2000, Annette King said that the DHBs would be expected to work together and to enter into cooperation and collaborative arrangements to ensure service delivery to their population. Sadly, that has failed to happen over the last 9 years. We don't see good collaboration between the various DHBs. And sadly, Annette King also missed out of her speech the fact that they should ensure there was efficient and effective service delivery. And sadly, we have seen over 9 years a burgeoning bureaucracy. We have seen poor productivity in the health sector. We have seen disempowered clinicians, and we have seen a huge amount of money put into health with very little to show for it in terms of increased elective surgery. This bill is all about redressing that. It is about making the current system work better without revolution or without major restructuring, and that is why it is supported by all the submitters, and I sincerely hope that it is supported by all the other parties in the House, as it was in the first reading of this bill. In essence, the changes are about having more effective coordination on a local, on a regional and on a national level. It is about freeing up back office bureaucracy so that those services can be put to the front line, those resources can be used more effectively, and it's also very importantly about empowering clinicians and clinical networks so that they can once again take charge of running our health system after a long period where they have felt in many respects very helpless. Mr. Speaker, one of the interesting things about this bill in terms of its support by all the submitters, and hopefully all the political parties on this occasion, is that over the last 25 years we have seen over the electoral cycle huge turmoil and restructuring in the health system. Way back in 1987, when Helen Clark organised the Hospital Services Task Force report that was known as the Gibbs Report, there was a realisation that we must have better monitoring and measuring. At the times, there was no measuring of outputs or outcomes or quality of service. But certainly, there was an attempt to put this into place. It was the beginning of things happening. Sadly, by 1989, things had become so dysfunctional that the Auckland DHB was actually disbanded by Helen Clark with her own husband as a member. The 1990s saw some radical changes, not all of which were good, but certainly by the end of the 1990s, the Health Funding Authority, which was run extremely skillfully by Dr. Graham Scott, had become a very effective, efficient contracting agency. And it was very sad in some respects. It was very sad in some respects that once again, in 1999, with the change of the government, there was radical changes and restructuring that led to the massive bureaucracy, that led to the fragmentation into the 21 DHBs and led to the disempowering of clinicians. And it is this bill that is set out to redress those problems. It is a huge worry that we have seen Murray Horn identify it as impossible to increase spending on health by 8% a year over and above inflation. It's just impossible for New Zealand to be able to sustain that spending. We have to drive efficiencies into the system. The Health and Quality and Safety Commission is a very, very welcome change indeed, and it is being ably led by Professor Alan Merry. As far back as 2002, Peter Davis pointed out that something like 12.9% of people admitted to New Zealand hospitals suffered an unintentional injury caused in the management of their conditions. This has huge repercussions, both in terms of personal harm, but also the cost savings that could be attributed in the order of $500 million a year to $800 million have been estimated as possible savings if the quality measures can be brought in successfully. Mr. Speaker, during the committee stages, we will have the opportunity to debate issues that have been brought up by the NZMA, such as an overarching health strategy, clinical leadership, and indeed public consultation, which I believe the Minister has very ably addressed in his earlier speech. Mr. Speaker, it is vitally important that this bill is supported by all the parties in the Parliament, as it was by the submitters, and I look very much forward to the committee stages.
Called Ian Lees-Gallagher.